right. In this video, we're going to talk about patient education, how to pre-frame the experience for the patient from the beginning to avoid confusion and frustration. So it's important to recognize that when we're setting up and educating the patient, must be done by a provider, and that is the provider is adding them to the software. They're getting the patient then gets a text message and a email link that is unique to that patient, that then you walk them through the process of installing the software on their mobile device, or helping them learn how to use this on a web browser if they don't have a mobile device. And then the provider is creating the home program for the patient. Um, it's important to help the patient through the process using either the text message or the email link. And when they're going through that process, there's going to be several prompts that come up that um, ask the patient to allow us to collect health data and allow push notifications. The health data that we collect are step counts. So we're collecting step counts, and then the push notification is a daily reminder to perform their homework. So those are two very important pieces of remote monitoring. That's data transmission, and it's trying to encourage engagement, but it's important to educate the patient about that on the spot from the beginning. So, pre-framing the future, letting the patient know their engagement with the home program is being monitored, meaning you can see it, someone on your team can see it. We can tell whether you're engaging with your home program or not. That's really the point of this whole program. And you need to state what the goal of the monitoring is. And what I say is patients who do the best in physical therapy or whatever rehabilitation department you're in, the patients who engage more frequently with their home program do better. So this program was created by the insurance companies to help increase your engagement and your outcomes so you have a better experience while you're getting services. Um, Ignore the title here. So every day, each day they will be asked if they're having symptoms when they go into their software, and it's going to say if you say yes, then the patient is going to ask to rate their pain from 0 to 10. If they say no, it just moves on. You want to show also the patient where they can chat with you as a provider or the remote provider that's on your account. Um, that each person can chat back and forth, and you want them to chat back and forth when they have questions or concerns. You need to indicate that a member of our team, your team, will be contacting the patient once a month via the phone to check in with them. This is something that's required by the insurance companies. And it's really the point of that check-in is to have a conversation about how the patient is doing with their home program, if there's any barriers or complications they're having. But letting them know there's going to be a phone call is crucial. It's also important to educate the person about what it's going to, these unique insurance reimbursement or situation. So you need to indicate that you get reimbursed by the insurance company for the use of this mobile application, which helps the patient have better outcomes. And after the completion of each month, we then submit to the insurance company the month's activity so we get reimbursed. And this will be on the patient's explanation of benefits and will have a data service that does not represent a visit in the clinic. One of the most common issues we have with patients is that they get an EOB 30 or 60 days later after their last visit in the clinic and they see charges on a data service that did not exist. And so naturally they feel like something's not being done properly. So it's important to pre-frame that in the beginning. Um, it's important also to let the patient know they're going to have access to their home program for an unlimited amount of time, and that we monitor their home program, the activity, for a month after they're in for the last visit. Or if you've chosen a customized date, tell them that. And so that letting them know they're going to get a phone call from a team member, a month after their last visit with you, or 2 months after their last visit, just to check in to make sure they're doing okay. Patients like the check-in. They don't like it if they don't know what's going to happen, though. And it would be highly recommended that you provide some documentation for the patient to take home regarding what we're talking about today. We've given you some sample documents, but certainly creating your own document to fit your culture of your company with this information so that the patient is not confused.